And mass vaccine rollouts are taking place around the world, but new research suggests vaccines have failed to stop COVID transmission. In fact, the data shows the prevalence of the virus increasing in fully vaccinated people. This as pollsters say most voters don't trust major pharmaceutical companies now. Trinity Chavez is outside of the Pfizer headquarters in New York with more details.
As biopharmaceutical companies like Pfizer are rolling out vaccines around the world, experts say that getting vaccinated is still the best protection against the virus. However, new data suggests that the positivity rate among fully vaccinated people who are 60 and over is actually rising, further fueling doubt that many have when it comes to the pharmaceutical industry.
Today, newly released data suggests mass vaccine rollouts have failed to stop COVID transmission. According to a medical study in The Lancet, the prevalence of the virus is increasing in fully vaccinated people. After examining new infections in Germany, researchers found that the rate of cases among fully vaccinated individuals ages 60 and older has risen from 16.9% in July to 58.9% in October. That's a 42% increase, suggesting that fully vaccinated people are a major source of COVID transmission. Throughout Britain, the number of household contacts exposed to unvaccinated cases, which was 23%, was slightly lower than the number exposed to vaccinated individuals, which was 25%. Furthermore, an outbreak in Israel that infected multiple healthcare workers and patients, as well as their family members, came from a fully vaccinated hospital patient. This at a time where most American voters don't trust major pharmaceutical companies and think that drug makers have too much influence over America's healthcare policy. A new national telephone and online survey by Rasmussen Reports finds that 53% of likely U.S. voters don't trust large pharmaceutical companies, including 19% who don't trust them at all. Only about 6% say they trust major drug makers a lot, while 36% of voters somewhat trust them.
Now, I reached out to Pfizer to get the response on both of these studies, as well as the CDC, to get their take on the transmission rates among fully vaccinated people. However, I have not heard back. For In Question, Trinity Chavez, RT New York.
For more on this, we will turn to our panel. Dr. Marilyn Singleton, she's here. She's an anesthesiologist and was an assistant professor of critical care at Johns Hopkins. And our friend, investigative journalist, co-host of Boom Bust, Ben Swan. So, Dr. Singleton, good to see you again first. Now, in your years of practice as a physician, have you ever seen this level of disdain or at least skepticism of the medical community at large, in this case, Big Pharma, in your career? Why do you suppose this is happening now?
There was a time when the pharmaceutical companies gave us black bags, stethoscopes, which medical students gladly accepted. And then over time, there actually was a protest, and students started to refuse to take these black bags because of the high prices and said, spend the money on poor people. Now, the pharmaceutical companies have donated samples to free clinics and whatnot, so they've tried to do their job. But recently, it's gotten a bit outrageous with all the ads on television, direct-to-consumer ads, which many people believe is part of what increases the high price of drugs. And it's unnecessary. If you go to your doctor, they'll tell you what drug to take. And it's part of the problem also is the patients are losing connection with their doctor, with the big health systems and drug formularies where the physician has less choice in what to give the patient. So all these factors pile in. And I think right now the pharmaceutical company is very easy to blame. Big Pharma, it's a good target right now, and deservedly so.
Ben, who would have thought that this would be the one thing uniting Americans? I mean, around 75% of Americans have at least some distrust for Big Pharma. The numbers look around the same across all political parties and lines. 70% of those respondents think Big Pharma has too much influence here in Washington. What do you think?
Well, I think they do have too much influence in Washington. I guess I'm one of that 75%, right? Because obviously I have great disdain for not just pharmaceutical companies. I think the companies are fine themselves, but their practices in terms of influencing the science, influencing the culture influencing Washington, and I would say they have way too much influence in media. Thank God for outlets like RT that don't take pharmaceutical money. But if you watch any other network, CNN, NBC, ABC, CBS, right, there are videos out there on the internet that show you, the brought to you by Pfizer logos that go up on all these different news programs. It's a huge problem because they are able to influence coverage. Look, and by the way, this goes far beyond just the COVID issue and the vaccine issue. It goes back to the fentanyl issue, the OxyContin issue. Companies like Purdue Pharmaceuticals that are paying out record numbers of fines because of the fentanyl crisis that we're seeing in this country and the opioid crisis. So it's a long history. I agree that it's deservedly so that people do not trust pharmaceutical companies, but we also need to not trust those over whom pharmaceutical companies have put their influence. And that includes, by the way, the FDA and the CDC, because there is a revolving door between those agencies and big pharma that also leads to a whole lot of corruption.
Now, let's talk about the government's mass vaccination campaign. It would appear that it was largely coercive and very rigid, and some have even called it a complete failure. I'd like your thoughts on that, Dr. Singleton.
Certainly the vaccines have been shown to decrease the severity of COVID, the disease, and decrease deaths. However, the vaccines, the type that we have right now on the market, are so-called leaky vaccines or imperfect vaccines. That means that they don't stop infection and they don't stop transmission. So going back to what you said earlier in the story about seeing the increased transmission, the more you vaccinate, the more transmission you're going to get, because the virus wants to evolve so it will survive. So it evolves around that specific spike protein that the vaccine is directed toward. And this is why more studies are showing that natural immunity is stronger, because it's more global. It's immunity to the entire virus, not just that one little spike protein. So that's what we're seeing, is this evolution of more transmissible viruses. Now, the good thing is they might not all be more lethal, but they are more transmissible.
Now, Ben, walk us through a little bit of how the government has gone about getting everyone vaccinated.
Well, listen, in the United States, there's been a whole series of these steps, right? Which, by the way, most of them are being rendered as unconstitutional. The Biden administration keeps putting out edicts and orders and trying to do runarounds using OSHA in order to create so-called mandates. They aren't actually real mandates. He's trying to use the private sector to force it upon employees. And courts keep ruling that this can't happen, and yet the Biden administration keeps pushing forward. Look, there's several severe problems here, and Trinity mentioned in her report. As you know, Manila, I've been reporting on this for months now, that there have been a series of studies that continually show that the vaccines, not only do they not prevent transmission, but they also don't even prevent, in some cases, hospitalization and even death. And if you don't trust those numbers, look at what's happening in the UK, because the UK's numbers show that's happening. One thing that we have to remember when people say trust the science is you have to look at the fact that there's a lag period. And so we roll out all these mass vaccinations and we're pushing for it. And what was just said right now by our other guest about natural immunity, the fact that that is entirely ignored in the United States. It's not ignored in Europe, because as I've told you, over in Europe, in many cases, they recognize natural immunity. But here in the US, it's completely ignored. The fact that that is ignored, while simultaneously, we're hearing just this week that not only do you have to have 2 full doses of the vaccine and a booster shot, but now you're going to need a 4th booster from the Omicron variant. I mean, there are so many people out there who are thinking, we'd just be better off allowing coronavirus to go through our systems naturally. Obviously, you have to take care of the people who are most at risk, but for those who are not, it's like, this idea of being in a perpetual state of being jabbed with boosters, it just seems insane to people.
Dr. Singleton, quickly, your final thoughts on this. President Biden's expected to announce a slew of new policies today after the first confirmed Omicron case was found in California, where you are. Are any of these going to work?
Probably not. One of the biggest things we have to look at, don't make the same mistakes that we've made over the last 2 years. We have found lockdowns, masking children, all the just interminable vaccinations that we're seeing don't necessarily work. Stop it. Just stop and move on to new measures.
All right, we will leave that right there. Dr. Marilyn
Hear, hear.
Singleton and Ben Swan, thank you both for weighing in.
Thank you.